Hello everyone, welcome to this special webcast brought to you by the Conference Board in partnership with KindBuddy. I'm Amy Yi, researcher here at the Conference Board. It's a pleasure to welcome you all to today's program. And our topic today is family building in a new COVID world. Here are some of the questions we will be discussing today. Fertility care is very important, but perhaps not everyone on the call today is very familiar with this field. So our experts from KindBuddy will share some of the latest updates and guidelines on fertility and family building care. And secondly, we are all living in this COVID environment, and coronavirus has affected our life and work in many different ways. So how is COVID affecting the benefit space, and how companies can continue providing care for employees amid the crisis is a question we will be discussing today also. And as it comes to fertility, one of the biggest issues, both from the patients and also employers, is affordability. So our experts will also explain fertility and family building and why it has historically been so expensive and what you can do to keep the costs low. And last but not least, as we adjust to this new normal, people are interested in understanding what the future of fertility and family building looks like. But before we address these questions, I want to go over a few details about how you can best participate in today's webcast. First, I encourage to actively engage in the conversation. You can type your questions and comments in the chat box on the screen. I and the guest speakers will be monitoring your comments and questions. We will be addressing them as we go along. And secondly, you can download the presentation. The link is at the bottom of your screen. So to make the screen larger, you can click on the 4 arrows at the top right-hand corner of your screen. There will also be a brief evaluation at the end of today's presentation. It will only take you about a minute to complete, and we appreciate your feedback. And also, the webcast will be made available on demand following today's presentation, so you can access it anytime on the Conference Board website, and feel free to share with your colleagues who might also be interested. And for those of you who are seeking continuing education credits, please note that the credits are only available for those who attend the entire live show. So please type your name, email address, and credit type in the space provided below. If you wish to earn CPE credits, please also check the 3 pop-up boxes that will appear throughout the program. Without further ado, I'd like to introduce the 2 experts from KindBuddy who are joining me today. So we have CEO and founder Gina Battesi. As a former founder and CEO of Progeny, Gina launched KindBuddy in 2018 as a direct response to employer needs. We also have Chief Medical Officer Dr. Lynn Westphal. So Dr. Westphal is a former director of Stanford's Fertility Preservation Program, Third-Party Reproduction Program, and Women's Health Program. She currently serves on the board of the Society for Assisted Reproductive Technology. Thank you both very much, Gina and Lynn, for joining us today. So Gina or Lynn, before we delve into some of the questions I just mentioned earlier, could either of you give us a quick introduction about your company, KindBuddy?
Yeah, happy to do that. Thanks, Amy, and thanks everyone for joining today's webcast. I'm Gina Battesi, founder and CEO of KindBuddy. KindBuddy really seeks to reinvent women's healthcare, and KindBuddy grew out of a lot of the dialogue I had over the last several years with primarily large self-insured employers who sought to do 2 things. The first thing was to buy services direct in an effort to provide increased transparency at a lower cost. And the second thing was to provide a holistic women's health and family building solution. Employers talk often about having too many point solutions, and they wanted one solution that could solve for mental health related to trying to conceive or depression related to multiple miscarriages, nutrition, wellness, GYN. So, but that's really why we started KindBuddy in the summer of 2018. And this slide.
Great, thanks, Gina.
Yeah, Amy, great. This is a screenshot. We have brick and mortar clinics in San Francisco, New York, and Los Angeles, as well as a provider network. This slide says 150 locations. I'm happy to share with you that we have 182 additional locations around the country. But we've reinvented patient care, and you can tell it aesthetically how we treat our patients, how we think about wait times, how we think about utilizing technology. So we've reinvented the member experience You can visit our locations, or we're happy to serve you 24/7 via virtual care. Did you have any more questions, Amy, before we jump in?
No, I'm good on my end. Yeah, thank you so much for the introduction. It's really helpful for me and the audience.
Great. And then, Amy, you ready to get started?
Yes.
Okay, great. As Amy mentioned at the beginning of the webcast, we do want this to be interactive, so there's a chat box. Please feel free to ask her questions. We'll get to as many of them along the way as we can. But again, for those of you who have not been in one of our locations, you'll see that it's warm, it's welcoming. Our office hours are really intended to serve you and serve your member population. That means we have early morning office appointments. It means we have after hours office appointments, weekends. This Kindbody was really built, again, around the member experience. At Kindbody, we provide 7 guarantees. Employers are really looking, again, for price transparency. Cost is a more motivating factor than it was kind of pre-COVID. We've heard a lot of requests for direct purchasing. So when employers think about adding a fertility benefit, there are networks that they can utilize. Those networks look and work similar to insurance companies. And so similar to a fully insured or a commercially insured client, you're going to pay a commission or a fee of about 20% in addition to the doctor's fees. What you've seen as more and more employers move from fully insured to self-insured is a desire to control for cost and impact costs through negotiation and leverage. And you do that by removing the middleman and contracting directly with the doctors, which is what we do at Kindbody. Dr. Westfall is our Chief Medical Officer. She joined us in January 2019 full-time after a long 23-year career at Stanford University, and so you can find Dr. Westfall in our San Francisco office. Most days we're building another location on the peninsula this fall. But direct purchasing, again, most of the savings are 30% or more. We also provide quality guarantees. What's not known to many outside of the industry, but is well known inside the industry, is there have been technologies in the lab over the last 5 or 6 years that have created parity and success rates across the country. Specifically, I'm talking about vitrification, which is the flash freeze process, and genetic screening. So the human body is actually not that good at reproducing, even for the most fertile couple. Their chances of conception in natural conception are only 20% every month. There's a high rate of miscarriage in natural conception because 50% of embryos are genetically abnormal. And so today there's a process that was not that well utilized 5 to 10 years ago, but is a standard of care today. It's called genetic screening. Genetic screening is not appropriate for all patients. Lynn can speak to it, but our clinical recommendation would be for patients with lots of embryos, which have a tendency to be younger patients, those under 35. And on the other end of the spectrum, patients over the age of 40 probably wouldn't benefit from genetic screening either. But the majority of fertility and family building patients are 35 to 40. About 2/3 of the patients fall within that age group, and they can benefit from genetic screening. So genetic screening is exactly what it sounds like, and it allows our embryology teams and our clinical teams to choose which embryo is euploidy versus aneuploidy, which just means has the normal number of chromosomes versus the abnormal number of chromosomes. So in any kind of industry, and certainly in the healthcare industry, if you have parity in success rates, which is now happening because these two technologies are, again, a standard of care today, you do start to see parity in success rates. What should happen is parity in pricing. And that parity in pricing has not happened yet. There's still quite a bit of variability between pricing, and the question is why. We would share with our listeners that the employers just really haven't leveraged their negotiating power to the benefit that they can. Because historically, the primary way to provide a fertility benefit was to go through the networks or to use an insurance solution, whether that's a carrier or the network. And so I think, again, it's going to be hard to control the continued price inflation if the employers don't do some direct contracting. The other thing we hear in the fertility industry, we know there are lots of add-ons. Again, genetic screening and other ICSI, assisted hatching, there are all these additional add-ons or technologies. What we do at Kindbody, which has been really well received by the employers, is to move to a value-based case rate, a bundled case rate. Historically, if employers have a fertility benefit today, it may be run through their carrier. They may have a dollar max of $20,000 or $30,000. And then what happens is the member is, that doctor, the provider, is hitting that CPT code with the intent to move that patient to exhaust their lifetime maximum and move them to a cash paying customer. So instead of continuing for providers to bill on a fee-for-service basis, we see the future of healthcare as collaborative, not competitive. We see the future of healthcare as more and more employers moving from fully insured to self-insured, and we certainly see the industry moving from a fee-for-service basis to a bundled case rate so that employers can really project and manage their costs. Total transparency, before we hired a single doctor at Kindbody, we invested in technology. So we own our own proprietary EMR, our own scheduling system, our own patient portal. What that does is allow for transparency to the employer based on utilization, and it really just improves member experience. Today, 1/3 of fertility clinics are still on paper charts, so it's really hard to be transparent and get a lot of data out of paper charts. There's quite a bit of telephone tag between the clinical team and the patient population. We seek to eliminate that telephone tag by having everything digitally and conveniently built into the technology that the patient has. Because we are in the doctor business, we're already integrated. We are already in the large carriers' networks. Again, we provide an end-to-end solution. If the employers won't, if they prefer just a fertility benefit, we can serve for just that niche of a fertility. They've called it an infertility benefit. We've moved away from an infertility benefit because we see lots of interest from same-sex couples and from single moms by choice and others, egg freezing patients who are not classically infertile. They're actually fertile, but they can't conceive without assisted reproductive technology, so we talk about a fertility solution. Employers can either think about just a fertility solution, or they can also work with Kindbody to have an end-to-end solution. So we talk about pre to postpartum care, and that includes return to work, lactation consulting, other coaching, and support. And I mentioned the technology. We're going to share a video where patients talk about the technology later. But I think after being in the industry for 10 years, and then specifically the last 5 years in the industry, what we know is different at Kindbody that was different than the platforms is, in order to effectuate change in healthcare, we would argue that there are only 3 things that matter in healthcare: patient experience, patient outcome, and cost. And you really have to be in the provision of services and the delivery of care in the doctor business to effectuate change. And I think this is the first video, Amy.
We believe that
It looks like we're having some buffering issues. So I'm going to let
going
Carmen
to the doctor
and the
should
team
feel like a
at
visit.
the conference board. Let's see if it'll play through this time. Yeah, if you guys want to continue to work on that buffering, I think we can probably, Amy, jump to the next thing. If you let's go to the slide, Carmen, and then you guys can come back to that video. And I think the next slide is the poll question, Amy.
Yes, we have a poll question to our audience. Very quick question. Do you currently offer fertility family building benefit? The answers are yes, no, no, but looking to learn more. So we will give our audience about 5 seconds to respond to this question. 5, 4, 3, 2, 1. Close the poll. Okay, so it looks like half of the participants select yes, and about a third said no, and the rest are a no by looking to learn more. So Gina or Lynn, the results surprise you or resonate with what you have seen from industry?
Yeah, I mean, I think it's good insights for us that 50% already have a fertility benefit and then 50% are looking or inquiring about potentially adding one. I think, you know, historically about 25% of the Fortune 500 had some form of fertility benefit. The fertility business is relatively new as an industry, and so when people say they have a fertility benefit, it can be quite complicated. It could be just the fertility, the diagnosis of fertility, and that's their fertility benefit. In many cases, we see employers, again, that have this lifetime max, and the lifetime max could be $20,000 or $30,000. The challenge with those lifetime max run through the carriers is, again, the fee for service. They get a lot more bang for their buck or value if they move from a fee for service to a value-based case rate. And then we see, again, a lot of employers that don't have a fertility benefit but are interested in adding one. This primarily comes from the member population. You see a lot of members now requesting egg freezing, more generous benefits, particularly for the LGBTQ community. And so the interest in adding a new family building benefit is high. I think the other thing that we hear from employers is historically it's been cost prohibitive. So I know several employers that offer a fertility benefit today are looking for a more affordable option or a more affordable replacement and a way to really buy direct so that they can have control over that pricing.
Perfect. Thanks, Gina. And regarding the video, I'm sorry about the technology difficulty, and I think it's a YouTube link. Maybe we can share the link in the chat box so that others can watch the video after
that would be great, Amy.
The webcast.
The video just really speaks to Kindbody's member experience and how we think thoughtfully about everything from, again, the aesthetics when you walk into a Kindbody location. Most of our locations are retail. They're in high populated areas. So in New York City, our location is on Fifth Avenue between 15th and 16th. In San Francisco, it's at the corner of Sutter and Montgomery, right in the heart of the financial district. Again, really rethinking the member experience so that our locations and our care is really serving where the customer is, where that member is, instead of insisting that the member come to us or come to a hospital setting. So we also have a mobile clinic. That's a couple of mobile clinics that have been wildly popular for our member population as well. So hopefully you'll have time to watch the link on YouTube. We're happy to share it after today.
Perfect. I think the link is already on the screen. And I did see some articles about your fertility bus in some cities. So it's really cool. Yeah. Okay, with that, Gina, I'll turn to you or Lynn for the next section.
Lynn's going to talk about the clinical piece of it. Again, you know, I think just so you guys have the lay of the land, and Lynn's going to correct me if I get it wrong or she's going to speak to it, but you know, there was high interest in fertility and family building benefit kind of prior to COVID, pre-COVID, and then in mid-March with some of the government shelter in places and shutdowns. Our clinics were closed. We were closed for about 5 or 6 weeks in our respective locations. The governing body, ASRM, American Society for Reproductive Medicine, there's another governing body, the Society for Assisted Reproductive Technology, that Lynn serves on the board of, or Dr. Westfall serves on the board of. But they encouraged all fertility clinics to pause cycles, except for urgent cases, and an urgent case would be defined as oncology. But the member interest and the patient interest in fertility has remained high. Dr. Westfall?
Thank you, Gina. So I'm a fertility specialist, and when patients decide that they're ready to have their families, they usually want it to happen immediately. and don't want any delays. By the time infertility patients come to the clinic, they've been trying usually for a long time. Infertility is diagnosed after a couple's been trying for a year. At the very beginning of the pandemic, obviously we didn't know the impact on the healthcare system and how severe things could get. And as Gina mentioned, all non-emergency procedures and treatments were put on hold. I'm sure many of you had visits that were canceled, and fertility treatments were canceled except for patients who were about to get treated for cancer. So those patients did continue because they were considered emergency cases. Once we saw that the curve was being flattened, we slowly resumed care, incorporating a lot of safety things that I'll talk about in a minute. And we did initially start with the more urgent patients, so patients that were older and patients who had diminished ovarian function. And now we are back to treating anyone who's trying to get pregnant or freeze eggs, doing any type of treatment. Obviously, this has been a rapidly evolving situation, and our guidelines have changed almost day by day based on what's going on, what we're learning, and what types of testing we have available. So as you know, testing is not still as readily available as we would like. Anyone taking care of fertility patients realizes that this is essential care, and it was really great during this whole pandemic to see that a lot of other people recognize this also. Even Governor Cuomo specifically came out and said that fertility care was essential care. Since it's not known how long this pandemic will last, no one is telling patients that they shouldn't get pregnant. While we don't have information about the impact of this virus during 9 months of pregnancy, since it's only been about 5 to 6 months since the virus has been recognized, we still don't know the impact. But as far as we know, we don't see that there's an increase in birth defects, so it's very different than the Zika virus. We also do not see that pregnant women are more likely to get COVID-19, and even if they do get COVID-19, they're not more likely to get severe disease. Obviously, when patients do get pregnant, they are going to be probably even more vigilant than usual, and so we do want people to be as careful as possible. Because we don't have a lot of information, Kindbody is part of a national group that's collecting data. Any of our patients who get pregnant at this time, we are following them during the pregnancy, and hopefully we'll have a lot more information about the impact of this disease going forward. We also know that a lot of patients have anxiety because of some of these delays and just not knowing what's going on. And Kindbody has a lot of things in place to support our patients. So for example, we've had a lot of virtual sessions, and we also have an easy way for patients to schedule a therapy session on our website. We are educating and counseling our patients all the time about the impact of this virus, and we know that there are a lot of gaps in our knowledge. So we're telling patients that if they do get ill during their treatment, that they may need to have their treatment delayed. We don't want patients coming to the clinic if they are ill, and we want them to recover before they resume any care. So to provide treatment as safely as possible, we want our patients and our staff to stay healthy. We have a number of safety measures that we've put into place. Obviously, we're very strict about our social distancing in the clinics. We are constantly cleaning any high-touch area in the clinic and disinfecting every room after the patients are seen. Both the physicians and any staff in the clinic are wearing masks at all times, as well as the patients. So everyone is wearing a mask whenever they're in the clinic. We do screening for everyone entering the clinic, so both staff and patients have a temperature check when they enter the clinic, as well as complete a healthcare survey. And then we're limiting entry to everyone only to people that absolutely need to be there. And if possible, we're trying to do as many things virtually as we can. We still are doing a lot of virtual consults. And then, of course, constant hand washing. So everyone is doing everything they can to keep the clinics as safe for the staff and the patients.
Thank you, Dr. Westphal. I think that's right. Like some examples of how patient care has changed during COVID versus pre-COVID. We do a lot of teaching at Kindbody. It wouldn't be atypical to have more than one clinician in an exam room. Maybe you have a sonographer and a nurse, or you have a doctor and a nurse. Today we limit the number of clinicians. It's one clinician in the exam room with the patient at all times. So we really have rethought, again, waiting room, social distancing in the waiting room. Everyone wears masks. All of our clinical team and the patients wear masks. I will tell you that interest in and the support from the member population has remained high through COVID. As Dr. Westphal mentioned, people that are working hard to build a family have already often waited a while before they seek treatment, and so they're eager to move forward. And so Kindbody, along with other clinics in the country, are doing everything in their power to provide the safety and have revised standards and how we process and doing our SOPs in the office, again, taking every precaution to make sure we can deliver a high quality of care and protect the safety of both our team members and patients. And then I just wanted to add a few things that Dr. Westphal said. Infertility is diagnosed after the patient has been trying for 12 months. ASRM and the other governing bodies would say for patients under the age of 35, for older patients, but patients over the age of 35, it's usually 6 months that they've been trying to conceive, because the number one thing affecting the patient's success is her age. That's true for egg freezing patients, it's true for IUI, IVF. Really the number one thing, whether or not that patient is going to have success and to what degree the success is, whether that's one cycle or two cycle or multiple cycles, is the patient's age. Historically, you have very good prognosis for patients under the age of 35. Even 36, 37-year-olds still have pretty good prognosis as long as their ovarian reserve is good. Good can be measured today via an AMH test. AMH should not be the only marker when measuring ovarian reserve, but it is a popular test. You mentioned our mobile bus, Amy. The first thing that we would say at Kindbody is to empower yourself with knowledge. Even if you're not thinking about getting pregnant, just knowing your reproductive health and knowing what your AMH level is can give you early insights into the likelihood that you're going to have success. Again, whether that's conceiving natural or with some assisted reproductive technology. So older patients and then patients that are 38, 39 probably do, again, need to accelerate treatment, think about trying on their own for 6 months instead of 12, and certainly over 40, even with the greatest clinicians in the world, and I would tell you we have the best clinical team headed by the best, arguably I'm not sure that how objective I am, but Dr. Lynn Westphal, as our Chief Medical Officer, has probably treated thousands of patients during her 20-plus career. But even under the best technology and the best clinical care, the chances for patients over the age of 40 are less than 10%. They're low single digits. It's not impossible. So we do really, at Kindbody, put a priority on simple education and knowledge. What this means for employers as we think about navigating family benefits in this new COVID world is, again, we are here to support you with knowledge. We do on-campus learnings up and down both coasts. We're happy to think about the middle part of the country. But really, when we serve the member population, we do like to go on campus. Members often have lots of questions. As Lynn has mentioned, in this new COVID, some of those educational sessions have been moved to virtual sessions. What's fantastic about our virtual care is folks from all over the world have joined us. We had 13 folks, 13 patients, potential patients join us in a virtual retreat a couple of Saturdays ago. I think it's interesting, we did the poll earlier, about half already had a fertility benefit, half did not, but we're interested in learning more. I think knowing that HR teams, most everyone would love to be able to offer a family building benefit. It is high on the member request. And the number one thing we know that prohibits both consumers, just on a D2C basis, as well as employers, is cost. And so we really think about how to make family building and fertility care the most affordable. And again, it has to do with utilizing technology for transactional things that can be done in healthcare, and really saving the clinicians for the more personal discussions. And we can talk about that. And again, hopefully that video will show on the patient experience in just a little bit. Again, I think we're all charged, whether we're in small companies or big companies, to do more with less. And there's a lot of discussion right now about this resiliency. What's fantastic at Kindbody, and most of our partner clinics have a support network in terms of mental health. Patients are nervous, understandably. Many patients are nervous absent COVID. During COVID, they are particularly nervous. So we have a care navigation team, a multilingual care navigation team that handholds the patient throughout the patient journey. That's true if they come to a Kindbody location. It's also true if they go to any of our 182 other locations. You have a Kindbody, we call them care navigation experts, to hold your hand. In addition to the care navigation, we do have, as Dr. Westphal mentioned, therapists. The majority of the therapy appointments, what's nice about that, can be done virtual. Again, our technology, to my knowledge, Kindbody is the only clinic in the entire country that allows patients to schedule and book online, to move appointments online. Seems unusual in today's environment that you would have to pick up the phone and schedule with your fertility doctor and then maybe get voicemail, and maybe they have to call you back. I mean, there's a tremendous amount of inefficiency and people that really should be moved to technology. And that's why you see, in many cases, high cost is they really haven't thought through how to remove cost from the financial equation. Again, because fertility, the fertility industry and the fertility benefits have continued to grow rapidly, more than double digits year over year. And so absent employers coming in and negotiating directly with doctors, we anticipate costs to continue to increase. And again, happy to share, again, I'm excited to play our patient testimonial because they can talk about the support that they received both from our clinical team as well as the technology.
Thank you, Gina and Dr. Westphal. Very informative. Before we go to the poll question, I saw there are two questions from our audience, if you don't mind addressing them. So the first is, do you provide any fertility services for men? And the second is, do you offer free education?
We absolutely offer fertility services for men. We need sperm to make babies, and so that means that men can freeze their sperm. We have collection rooms, so that's where, again, in IVF, you need eggs and sperm, and there's a collection room where men donate and provide their sample on site at our fertility clinics. So we do all kinds of male health. There's semen analysis. There's a semen analysis that has to be done on every male partner. I think that's another thing as we seek to educate our member population as well as our employers. People presume that fertility is a women's health issue, and that's just simply not the case. In fact, only a third of the time, is it a woman's issue. A third of the time, it is a male factor issue, and a third of the time, it's a combination of a male-female factor issue. So we absolutely treat and support men, same-sex men, transgender, hopefully that was helpful. The second question is, do we provide free education? In several of these mobile opportunities where we seek to educate the broader population, all of those services are complementary. In fact, the AMH screening is complementary, and I think, Amy, that's probably what you're talking about. When we were really first launching and introducing KindBody, you would see we would take our RV and our bus and our van around the country to really just educate this member population. So all of those services are complementary. To find out other complementary services offered and provided by KindBody, I encourage you to follow us on Instagram, and you'll find out, again, once kind of COVID starts to settle down, everybody's done an extraordinary job of flattening the curve and getting things headed in the right direction. I do anticipate our mobile efforts to start up again this summer, so follow us on Instagram and come see us and get free, not only free education, but a complimentary AMH test.
Perfect. Thank you. That's really helpful. And thanks to our audience who raised questions. And I encourage you to continue to ask questions throughout the rest of the program. So with that, we'd like to go to our second poll question. As Gina talked about earlier, that the three most important things in healthcare: patient experience, patient outcomes, and cost. So when it comes to fertility benefit, what do you value most? Is it a broad network of clinics or a curated network that's affordable? Experience, all of the above, or other? We'll give audience a few seconds to respond. Okay. 5, 4, 3, 2, 1. We will close the poll. Okay, see that majority, 70% of the audience select all of the above, and there are a few select experience and affordable network. So Gina and Dr. Westphal, any comments on the results?
Not surprising. We anticipated this, but it's nice to see it in data. So I think kind of pre-COVID, the labor market was high. It was incredibly competitive. Employers were adding very generous benefits at a very rapid clip. What COVID has forced is a recession, and in a recession, all employers, again, regardless of size, regardless of headcount, are asked to revisit cost. And so we thought cost was a driving factor since inception. Providing affordable care, we believe, should not be reserved for the top 1%. And historically, truthfully, fertility care has been deemed a privilege for an affluent class, and we said fundamentally something's wrong with that. If you're in the brokerage business or the middleman business, you cannot effectuate price. The only way to truly offer an affordable health care benefit for fertility and reproductive health is to be in the doctor business. So cost has been a key driver for us. So has member experience. Again, we believe that our patient population should receive a premium care experience without paying a premium price tag. So one of the things that we've done at KindBody, again, is to take feedback from employers. I would encourage you to reach out to Dr. Westphal or me on any of the social media channels, whether that's LinkedIn or Instagram, and bring us your ideas, because that's how we build a better solution. We've already heard from many of you, and that's really, again, at KindBody, there are two opportunities. We have what's called KindBody Direct, so that if the number one driver for the decision is cost, we want to add a family building benefit, but it's cost, we would move folks to what's called KindBody Direct. So those are our clinic locations as well as other KindBody partner clinics who have agreed to work for the exact same reimbursement rate that we pay ourselves and our own doctors. So we have a network of partner clinics around the country. What's great about that for the employer is everybody agrees to work for the exact same reimbursement rate, whether you're in Topeka, Kansas, San Francisco, New York, or Miami. And we really think about the ease of administration of the benefit for the employer. And we have this wild price disparity, never mind among state, even in a city like San Francisco, there's wild price disparity. You see it in large metropolitan areas. So it's one price across the country. Now, if you say, okay, cost is not my number one driving factor. If cost is, the cost savings are meaningful. They are in excess of 30%. In many cases, they're 35 to 40% cost savings. If you say, really, I want choice and cost is not the main driver, then we would go to an expanded network, which is called KindBody Plus. There are physicians who have a perceived reputation that's been built over decades, and those physicians are in our network, but they've requested a higher reimbursement price than even KindBody physicians. So we include those because historically, if we don't include those in our network, then we look like some of the carriers, and those physicians sit out of network. And we know the employers want to provide as much choice as possible for as cost-effective solution as possible. So the employer gets to choose. They do KindBody Direct, and they're in the Direct program, there's about 35 to 40% savings. Or KindBody Plus means we've gathered all of the doctors who historically sit out of network in the carrier programs. They're in the value-based case rate, but they are a premium to KindBody's own prices. But it still allows them a savings. The savings is probably going to be more in line with 20 to 25% with a broader network of choice than with the KindBody Direct. But we ensure all of our customers no gaps in coverage. So if you went with a KindBody Direct, that means you probably have 2 or 3 clinics in Seattle, as an example, instead of the 5 or 6. So if it's most important for you to drive choice in Seattle, then we would have all 6 in network in the KindBody Plus. But if you wanted to move towards the Direct, it's 2 to 3 clinics. So this slide is a great slide. Again, I mentioned it earlier in the webcast, but the big change that's happened in the fertility industry over the last 5 years is because genetic screening and vitrification have now become ubiquitous across the country. You're seeing standardization in success rates. So these success rates are pulled directly from the CDC. They're 2018 success rates. You see almost a flattening. If you look across there, you see almost parity in success rates. As this is 2018 data, I presume when you see 2019 and 2020, any 1, 2, 3, 4% in gaps will start to close, and this line will be completely flat 2 to 4 years from now. Again, the number one thing that affects success is actually the patient age. And so when we talk to patients, we really want to educate them because Dr. Westphal will speak, she sees too many 38, 39-year-olds who come in and say, but I'm healthy, why is my prognosis any better than it is? And it's because your biological clock doesn't have anything to do with your ability to have success. Your biological clock is, you're only born with a certain number of eggs and you lose them every single month. So again, the biggest goal when patients and employers talk about having success for their member population, we would tell them to be educated first. But again, this is parity, and this is a Los Angeles slide, but you see parity in success rates in San Francisco, in New York, really across the country. So the question is, why are the fees increasing and why do they remain highly disparate? The next slide. Yeah, so this is just a sample of cost savings. I mentioned this earlier, but if you look over to the left, those are self-pay rates. The majority of us work for work for companies who cannot afford to provide a fertility benefit. So from a consumer standpoint, we sell to employers, but we're also in managed care and in the carriers, and we have a direct-to-consumer program, so you see the rates over there. And then the employer rates to the right, again, the egg freezing savings are pretty material at more than 30%, and similarly on the IVF. While we're helping educate the employer population about what's changed in the reproductive health industry, prior to vitrification and genetic screening, the majority of all IVF cycles were what's called a fresh cycle. So you stimulated the woman, you did a retrieval, and then you fertilized the egg with the sperm, you grew it out to day 5, and you transferred that embryo. Today, so those were called fresh cycles. 5+ years ago, the majority of the cycles were fresh. Today, the majority of the cycles are frozen. because the majority of cycles today include genetic screening and vitrification. So I think that's the other thing that we can help employers. It's extremely complex. Unintentionally, it's complex, and the reason it's complex is because the fertility industry is still relatively new. It's only 3 decades old, and the science is improving at such a rapid clip to establish parity and success rates. So understanding when fees are, oh, is that a fresh cycle? Is it a frozen cycle? What is a frozen embryo transfer? How many do I have of those? So we're happy to answer questions, and we would always tell you that no question is too dumb. Just ask the questions, because that's how you get more informed. And then this is the member experience video that I'm excited to share. Let's see if the video plays this time.
I went to Kindbody because I
Yeah, we may be having technical difficulties. Yeah. It's okay, Carmine. We will also provide you this link as well. I encourage you to watch the video. If you watch it and don't cry, call me. It is an incredibly moving video. It speaks to how you know, the process is scary. When I underwent my first IVF cycle, I can remember, like, you're injecting yourself with medication. I will tell you, the more you do it, the easier it gets. But, you know, what members want is someone that is on this journey with them and really can be empathetic to everything they're going through. And so having our care navigation team, they're experienced nurses, they're experienced MAs, they know the fertility industry inside and out. But Jess of the couple there just says she couldn't have imagined a better partner on this journey with her, because I do think, you know, we have prioritized member experience from the very, very beginning. So it's an incredibly moving video, so please watch it, because we think, you know, again, in COVID and the recession, you like to drive costs, but I would tell you, if we were only selling a low-cost solution, Dr. Westphal and I, frankly, are not interested in that. Dr. Westphal and I are most interested in reinventing care to make it more affordable, but you should never sacrifice member experience for the sake of cost. The easiest way to pull cost out of the system is you purchase direct, you provide transparency, and you invest in technology. You don't need 50 billers billing and collecting from insurance companies or employers or patients if you simply use technology. So our investment in technology has really what's allowed us to bring down costs and focus then on member experience. I mentioned this earlier, but we have 182 partner clinics from around the country. We also have a global solution. I think that's the next slide, in fact. Lindsay, you want to speak a little bit about the global solution and the regulatory environment and what we see across the world?
Sure. So you can see that the regulations and the access vary greatly around the world. And because of these differing regulations, you do see that people will travel to get services that they want. So for example, you can see in Singapore, a single woman would not be able to do egg freezing, so those women do need to leave the country. However, it's interesting, Singapore is trying to be more family friendly, and at the beginning of this year, they actually removed their age limits. So they had an age limit of 45 for married women. So they removed the age limit, and they also removed the cap on the number of IVF cycles that a married couple could do. So it's kind of interesting. They've gotten much better at supporting their married couples, but still do limit their care. Other things like surrogacy and egg donation are not allowed in many countries. As a physician in California, where surrogacy is very supported, we do see people come from all over the world to obtain those services. Pre-implantation genetic screening that Gina had mentioned earlier also is something that is much more accessible in the U.S., so people will come for those services. And you do see a range in how people access the services depending on the coverage. So Denmark, which has very good coverage, 10% of the children born in that country are from IVF. In the U.S., it's about 1.6%. And, in countries with no coverage, it's going to be even much lower than that. Because KindBody is so tech-enabled, we are able to provide a global solution. We can have multilingual navigators and do that with telehealth and improve access so people can learn about their options no matter where they live in the world.
Yeah, great. Thank you, Dr. Westphal. And you guys can see, Dr. Westphal mentioned it, but Denmark has much higher utilization than the United States. The need is there. If prices were lower, the models show that 3 to 6 times as many people need services that can't afford it. The number one thing prohibiting treatment of folks that need it is cost. And so we are on a mission, again, to reduce costs. There are a couple of questions coming in, and we have a few more minutes. I'd love to answer some of the questions. One question is, when the patient has complications, do we treat them in-house or do we refer them to other physicians? So we provide many of the women's health services. I'm going to ask Dr. Westphal to weigh in, but I think it would depend on what the complication is. When we think about a full women's health solution that KindBody is, the part that we don't do that we definitely refer out is the obstetrics piece. So other GYN, other women's health issues can, in many cases, be solved virtual or they can come in the house. But from an obstetric standpoint, we do refer the patient out. And the other question is, are the providers you work with able to perform necessary procedures to prepare a patient for pregnancy, such as a myomectomy or endometriosis? And the answer is yes. We have hand-selected, again, Dr. Westphal has been in the industry for 25 years, and I've been in the industry for a decade. We have hand-selected the clinical partners. They're best in class. Again, many of them sit out of network. When the carriers, we've brought them into our network, even if we have to pay them a little bit more to be in network. They have moved to this bundled case rate. So, but they're highly skilled surgeons, and they perform all reproductive health surgeons. Dr. Westphal, would you add anything about complications or our network that can provide surgery in other areas where there are not KindBody clinics today?
So if it's a complication related to something that we've been performing, absolutely we take care of anything. If it's a miscarriage, we can handle that. Complications later in the pregnancy, they will have seen their obstetrician at that point, but we're always available. Patients, if something happens later in the pregnancy, we have patients call all the time, and get our input if they're going to, need some other testing or treatment. And we partner with the best people that we can find in every market that we're in to make sure that our patients get the best care and get the appropriate treatment for whatever their problem is.
Yeah, and the greatest thing about KindBody, I think the healthcare segment has been bifurcated in the past, and you didn't have anybody to help you navigate this journey. So remember, at KindBody, we serve that member population pre to postpartum. So even if we don't provide the service that the obstetrician will, you will always have your KindBody Care Navigation team member to provide you support services. So you can, even after we've discharged you to an OB, you'll have your Care Navigation support member. And again, that's based on member feedback. These members don't like the patient being dropped along the way. And so at KindBody, we hold your hand all the way through return to work. And I think we're a couple of slides. This is one of the last slides. You know, in summary, this is care in the new normal. We anticipate social distancing to continue for a while, at least into the fall and probably into the winter. We've adapted. What it means when we do our retrievals, if we used to do our retrievals from 8:30 in the morning to 12:30 in the day, we now start earlier in the day and then we extend our days. So we've embraced, our members have embraced this new normal. We know cost matters more than ever, but we would argue that you don't have to sacrifice, and you shouldn't sacrifice care for the sake of cost, and that patient experience is everything. Are there any questions before we adjourn? It looks like we have 2 or 3 more minutes. Uh-oh, we lost Amy maybe.
Sorry, I was on mute. Thank you, Gina, and thank you, Dr. Westphal. Yes, we do have maybe 1 minute for our audience to ask any last-minute questions. But in the meantime, I want to thank you both very much for the great insights and suggestions. I personally learned a lot from both of you about fertility care and family building benefits. So thank you very much. And I'm really impressed at the extent that KindBuddy has leveraged technology to break down the cost and also to enhance
thank you for joining us on the webcast today. Thank you, the conference board, and check out those videos today.
Yeah, definitely check out the videos. So before I close the webcast, I just want to show everyone that there will be a webcast evaluation at the end of this webcast. So if you could provide your feedback, that would be greatly appreciated.
And I just remind everyone also, we have a lot of virtual events, and so people can just go on our Instagram or website, and because I know people are interested in more education, and that's a really great way to just inform yourself about fertility and potential benefits.
Thank you, Dr. Westphal and Gina. Thanks everyone who's staying on the line and engaging in the conversation, ask questions. So here on the screen are just some upcoming webcasts from the conference board. They are COVID-19 related, so if you're interested, feel free to check them out. We also have a COVID-19 hub with all the resources that we recently released. And also we have a new podcast series called Human Capital Insights. I think it's a great resource for talent professionals to stay current on the issues in the human capital space and learn from each other companies about how to address some of their challenges. And if you're interested in sponsoring webcasts, feel free to reach out to us, and you can contact us by through the email address on the screen, which is sponsorship@conferenceboard.org. Thank you, everyone. Thank you for joining today. Have a great day. Bye-bye.